Let me teach you how to perform CPR. CPR stands for cardiopulmonary resuscitation. Forget grammar. Cardio means heart, pulmonary means lungs, and resuscitation means trying to revive someone. So in other words, CPR is simply a life-saving technique that is used to help restore blood circulation or breathing in someone whose heart has stopped beating. So how then do you perform this CPR? First, ensure that the victim's surrounding is safe. Then lay them on their back. Tap the victim and ask them if they can hear you. Can you hear me? If they don't respond, you proceed to check their breathing. How do you do that? Very simple. Observe for the rising and falling of their chest. If you notice that they are not breathing normally, then you call for help. Help oh, help oh, or you tell someone who is nearby to call the emergency services. Then you kneel beside them. Next, place the heel of one of your hands on their chest, just below the line of the nipple. Very easy to locate this way. Then place the other hand over the first hand and secure your fingers around it. Then you push hard and fast, going 2 inches deep this way. As you are pushing, you are counting 1, 2, 3. Again, while pushing, make sure to steady your elbow so that all your pressure will be on the victim's chest. Some people make the mistake of bending their elbow when they are pushing this way. No. So you steady your elbow, then you push. When you push, you wait for the chest to rise completely before you push again. But even at that, you have to be fast. So let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, up to 30 chest compression. Then you raise the victim's head a bit. Then pinch the victim's nostril with 2 of your fingers like this. Wrap your mouth over the victim's mouth and breathe twice into their mouth this way. Then you continue chest compression again. 1, 2, 3, 4, 5, 6, 7 into 30. So when you give 30 chest compression, you breathe into their mouth twice. Ideally, you are supposed to give up to 100 to 120 chest compression within 1 minute. Even though when you give 30 chest compression, you breathe twice into their mouth. But it is supposed to be that when they calculate the total number of chest compression that you gave within 1 minute, it is supposed to be up to 100 to 120. You continue CPR until the person starts breathing normally again, or help arrives, or you become tired. Then you allow someone else who can do it better to continue. Now, this is for people that are from 1 year and above. So how then do we perform CPR in babies less than 1 year? Ensure that the baby's surrounding is safe. Then you lay the baby on a flat surface. The procedure is almost the same like that of the people that are from 1 year and above, just a little changes. So when you lay the baby on a flat surface, next, tap the baby's foot to see if they will move or respond. If they don't move, then you check the baby's breathing. After checking their breathing and you see that they are not breathing normally, you call for help again. Help oh, or you call the emergency services. Then next, you place 2 of your fingers on the baby's chest, just below the line of the nipple. Very easy to locate. Then you push hard and fast. But this time around, you're going to go 1.5 inches deep this way. 1, 2, 3, 4, 5, 6, 7, 8. As you're pushing, you're counting up to 30 chest compression. Then you breathe into the baby's mouth twice, just like we did previously. So 30 chest compression, 2 rescue breath. 30 is to 2 rescue breaths. But that is if you are the only person rescuing the baby. But if you people are 2 rescuing the baby, then instead of 30 chest compression, you will now do 15 chest compression, 2 rescue breaths. 15 chest compression, 2 rescue breaths. But if you are alone, you give 30 chest compression, 2 rescue breaths. You continue this until the baby starts breathing normally again, or help arrives, or you become tired. Then you allow someone else to take over. As simple as ABC. I hope this was interesting and helpful. If so, make sure to share this video so others can learn. I'll see you all in my next one. Bye.